Morning, everyone. Let me introduce myself. My name is Fatkhur Rohman. I'm one of students in University Muhammadiyah of Semarang nursing study. Okay, today we talk about diabetes mellitus type 2. Are you ready? Okay, let's go. What is diabetes mellitus? Diabetes is the condition in which the body does not properly process food for use as energy. Most of the food we eat is turned in glucose or sugar for our bodies to use for energy. The pancreas, an organ that lives near the stomach, make a hormone called insulin to help glucose get into the cell of your body. What is diabetes mellitus type 2? Type 2 diabetes was previously called non-insulin dependent diabetes mellitus or adult onset diabetes. Type 2 diabetes may account for about 90% to 95% of all diagnosed cases of diabetes. Risk factors for type 2 diabetes include or age, obesity, family history of diabetes, pediatric history of gestational diabetes, impaired glucose tolerance, physical inactivity, and rest or ethnicity. Next, causes of type 2 diabetes. First, genes. Scientists have found different bits of DNA that affect how your body makes insulin. Second, extra weight, being overweight or obesity can cause insulin resistance, especially if you carry your extra pound around your middle. Third, metabolic syndrome. People with insulin resistance often have a group of conditions include high blood sugar, extra fat around the waist, high blood pressure, and high cholesterol and triglycerides. Fourth, too much glucose from your liver. Then your blood sugar is low. Your liver make and send out glucose. After you eat, your blood sugar goes up, and your liver will usually from slow down and store its glucose for later. But some people liver don't. They keep cranking off sugar. 5. Bad communication between cells. Sometimes cells send the wrong signal or don't pick up message correctly. When this problem affects how your cell make and use insulin or glucose, a chain reaction can lead to diabetes. 6. Broken beta cell. If the cell that make insulin send out the wrong amount of insulin at the wrong time, your blood sugar gets thrown off. High blood sugar can damage the cell too. Next, symptom of type 2 diabetes. First, fatigue or feeling worn out. Second, one that don't heal. Third, getting more infection. Fourth, hanger. Five, high blood level. Six, tiny or numbs your hand or feet. Type 2 diabetes risk factor. Risk factor release leads to your health and medical history include first prediabetes, second heart and blood vessel disease, high blood pressure even if it treated and under control. Third, low HDL or good cholesterol. Fourth, being overweight or obesity. 5. Having baby weigh more than 9 pounds. 6. Gestational diabetes will you were pregnant. 7. Polycystic ovary syndrome. 8. Depression. Other things that raise your risk of diabetes have to do with your daily habit and lifestyle. There are the one you can do something about. So, getting little or no exercise and smoking, then stress, and finally sleeping too little or too much. Treatment for type 2 diabetes. First, treatment typically include diet control. Second, exercise. Try to get 30 to 60 minutes of physical activity every day. You can walk, bike, swim, or do anything else to get your heart rate up. Third, home blood glucose testing, and in some cases, fourth, and finally, fourth, oral medication and get insulin. Okay, thank you for everyone attention my presentation. Uh, See you next time.